This is what you'll need for today's reconstitution. Now, you could use a 3 ml or a 5 ml. Today I've got a 5 ml syringe because that doesn't come with the actual Zomacton. All that you get with Zomacton is essentially the vial, the ampule, and the vial of powder right there. You want to make sure that you have a clean area to work with and that you washed your hands. That goes without saying. Then you want to take account of all the different items that you need to mix or reconstitute or add liquid to the actual powder. Now, the liquid is called a diluent or solvent, and this is included within the Zomacton or somatropin. So let's take a look and see what you have inside. So in the somatropin Zomacton brand, it comes with a glass ampule of bacteriostatic saline. So essentially it's salt water with benzyl alcohol mixed in here. And the next bit you've got is the powder, which is the actual somatropin powder, which we're going to add the bacteriostatic saline to. Okay, so you put your box aside. I've got some alcohol preps. I've got a sterile filter, or basically sterile blunt fill needle. You'll never want to inject with these. These are blunt and they will be very painful. So just want to warn you, don't inject with these. The other bits are, you can pick either or. We've got a 25 gauge needle for putting it through the rubber stopper. And we've got a blue needle if you happen to have that. You just don't want something that's too thick because you don't want to have a big hole. You don't want to have a big hole in your rubber bung. Right, now we're ready to get this prepared, get this ready. What I'll do is I'll grab my bacteriostatic saline and I'll simply prepare it. I may wipe it, sometimes I wipe it, sometimes I don't, with an alcohol swab. Okay, I also take the vial and I open the top on the vial like this, and I'll wipe this and let it dry. Okay. I'll prepare my syringe by opening the packaging and this packaging as well. And then I will attach the syringe to the filter needle. This filters out any of the glass particles that you have from opening the ampule. In Europe, they love to use these glass ampules, which is really annoying and frustrating if you're not used to them, how to open a glass ampule. So this is a technique you'll have to learn before you open a glass ampule, because you can risk cutting yourself or shattering the top bit, or you might even shatter the whole amount. So just be really relaxed. I'm right-handed, so my left hand, I hold the ampule. There's a little blue dot on this, and that's your guide. Make the blue dot face towards you. So the blue dot's facing towards me. And you can see that there. And then I just tuck my thumb on the blue dot, like that. I can have the blue dot in front of me. Okay, so that's in front of the blue dot. You move away, you use the away motion to open the ampule in a one quick movement. So don't squeeze the bottom, just hold it. Don't overly squeeze the top, because that's how you shatter it. And then snap it open, snap it away from you. Never snap it towards you, because that's usually how you break it. So 3, 2, 1, and it's really simple. Okay, so I put this aside. Again, my particular syringe is 5 mils. You might be given a 3 mil syringe. It depends what you have. We want to pull out the entire contents, about 3 mils out of this diluent. Place my needle syringe complex inside of the ampule, and I just withdraw or aspirate or remove all of the contents until they're empty. Okay, and that should be good. Now, again, at this point, I will swap out this needle. This needle's too blunt, too fat, and it will make a hole in the rubber bung. So you don't want to do that. So simply, you can just either twist the top off. This one's a Lure slip, by the way, so it doesn't really, you can just lift it off. Then you can place, I'm going to use the 25 gauge, which is a smaller gauge. It's just bacteriostatic saline. It's not very thick or viscous. I will just place that on there, and you just push it on. Okay, so it's pushed on. Be careful when you remove it. If you have a lure slip, if you get the 5 mils, as you take the cap off, be careful. It may bring the entire needle off as well, but in this case, I had it on tight enough. Okay, at this point, I'm probably going to remove most of the air. Oops. Okay, until I have just about the 3 mils, but you have to leave a little bit extra. The instructions in the Zomacton tell you to do about 3.147, a really awkward number, but because it's taking into account what you may lose in the syringe or the needle. But if you, your dose should be titrated around 3 mils. Then just essentially find the target inside of the in the rubber bung. Depending how good your eyes are, just place it inside there, and then slowly depress your plunger. Okay. And I find with this one, you don't really get any air, so you don't have to really worry about waiting until the air pushes it back. In this case, it's simply just put in the contents, and then that's it. And that's it. That's all you have to do. Your dosing will be given to you by the doctor. Again, each box of these Zomacton somatropins are 4 milligrams, which works out to be 12 IU. And it was very difficult to find, but our pharmacists and our contact with the manufacturer have confirmed, and it's from other literature, that 4 milligrams is 12 IU. And now you're ready for the injection. So the type of injection you would use, it would be a subcutaneous injection, and that's simply one of these all-in-one needle syringes, or insulin syringes as they're called. And you just would, like any other vial, enter it through the rubber top after you wiped it off with an alcohol swab and let it dry. Just good standard practice. You just do that, and then you can withdraw. So I'm not going to actually do the injection, but that would be how you would prepare this. Let us know in the comments if this has been helpful, or you can contact Balthor Hormones directly if you have more questions about your own particular treatment. I want to thank you for watching, and hopefully this helped.